There are a number of symptoms that can result from a traumatic brain injury depending on the area of the brain that was impacted. Even a seemingly mild injury can result in physical, cognitive, and emotional or behavioral changes in a child. The obvious signs that should alert a caregiver of possible brain injury include cuts and bruises to the head, bleeding that doesn't stop, extended drowsiness, lethargy, loss of consciousness, or a child that cannot be aroused, repeated vomiting, choking, or seizures. Other physical indicators include loss of balance or coordination, changes in responsiveness, unequal pupil size, eye tracking problems, loss of previous motor function, loss of grasping function, reductions in muscle strength, light or auditory sensitivity, general sensory impairments including changes in vision, hearing, taste, or smell, and/or complaints of headache or fatigue. Emotional behavioral changes may include extreme irritability, depression, anxiety, increased fidgetiness, low tolerance for frustration, inability to deal with unexpected events, moodiness, impulsivity, aggressiveness, changes in sleeping or appetite. Cognitive changes may include a decline in language, word-finding difficulties, trouble paying attention and staying focused, changes in speed of processing, difficulty learning and remembering new information or integrating new and old learning, and difficulty planning and following through with tasks. Other signs and symptoms can be more subtle, and children may appear quite normal. Parents and caregivers may minimize the effects of a concussion. Some symptoms may be immediately apparent following an injury, while others, due to secondary effects or developmental masking, may be delayed in their onset and therefore not related to a previous injury. In the case of accidents or abusive head trauma, the more life-threatening injuries receive the focus of attention, and the effect of a head injury may be overlooked.
If there was nobody there observing the event, then you're left with interpreting signs.
When our kids bump their heads and things, we just kind of think they're fine and move on. Obviously, it can begin to look like they're just sick. They can be throwing up and vomiting. It could look like they're just overtired because they're irritable. In families where there are divorces or trauma going on in the family or some sort of stress, it could be these kids are just irritable, they're not sleeping well, or they're sleeping too much.
Well, what you're left with saying is, okay, the child I'm seeing today is different from the child I saw in my daycare program or my nursery school classroom yesterday.
Oftentimes, most likely, they aren't doing the normal things they were doing before. For example, the developmental milestones that they had previously been doing, like rolling over and reaching for things, tracking with their eyes. Some of those things have changed, even a little bit, but you note that there's some differences in this baby. Could be some of the first indications that this baby may have some brain damage.
Does the baby focus on visual stimulation? Can you move your hands and does the baby follow something? Does the child suckle correctly? Does the child eat correctly? Does it have a normal orienting response? Can it, if it was walking before, can it now walk still? If it has, can it roll? Can it right itself? If it's an infant. If it's talkative, can it tell you that it has a headache? Or if it can't talk but it just cries all the time, does it seem like it's a constant crying? Are the pupils dilated? Do the pupils constrict the proper way? All of those are signs that if you get a positive sign, you have an infant or a young individual that's had a head injury.
In the more serious cases when a baby has been shaken, there can be some pretty dramatic kinds of symptoms. And those things can include that the baby is in a coma or the baby is seizing. They can have all kinds of problems, like they aren't moving hardly at all, or their breathing is very shallow. The part of the brain that controls the breathing starts to shut down, and so you hardly see the chest moving. These are all signs that the baby needs medical attention immediately. Important to get them to the hospital or call 911 immediately.
It is important that providers use caution and proper judgment before alarming parents about possible brain injury or in holding them accountable when there is concern about relatively nonspecific symptoms such as fatigue, irritability, depression, or an incidence of vomiting. Oftentimes, these symptoms, in the absence of other TBI-related cognitive symptoms or developmental regressions, are the result of short-term illness and do not necessarily mean that a child has sustained a traumatic brain injury. Currently, there are no good screening tools for evaluating TBI in young children. To further improve their ability to identify children with TBI, providers are encouraged to explore website resources and checklists from the Centers for Disease Control and the Brain Injury Association of America.